Hello, viewer. Nice to have you on board, and welcome to Adolescent and Youth Sexual Reproductive Health Rights digital platform. So today we are going to discuss matters teenage pregnancy in Nairobi, and we have on board a panel that includes civil society organizations. We have even adolescents on board, adolescents, teenage parents who are survivors, because like they're now 19 years and above, so they are going to share with us their experience. And then we also have a counseling psychologist on board, and we also have the coordinator for adolescent health in Nairobi Metropolitan Service, Madam Faith Kiruthi. So I will start off by sharing the statistics of teenage pregnancy in Nairobi County. So as you can see in the screen, in the year 2020, Nairobi County recorded young girls aged 10 to 14 years who attended the first ANC visit, and there were 2,603 in total. For those teenage girls aged 15 to 19 who attended the first ANC visit in Nairobi County, the total came to 19,560. So for Dagoretti North Sub-County, number of adolescents 10 to 14 years presenting with pregnancy at first ANC visit were 10, while those who were 15 to 19 who presented with pregnancy at first ANC visit were 1,143. Dagoretti South Sub-County, it recorded 6 adolescent girls who were pregnant, aged 10 to 14, while those who are aged 15 to 19, it recorded 1,056. Embakasi Central Sub-County recorded 176 who are pregnant, who are aged 10 to 14, while those who are 15 to 19 were 1,446. Embakasi East Sub-County, 576 adolescent girls aged 10 to 14 presented themselves at the health center, while, while 814 were aged 15 to 19. Embakasi North Sub-County, those aged 10 to 14 were 26, and those aged 15 to 19 were 1,476. Embakasi South Sub-County recorded 653 adolescent girls who are pregnant, while those aged 15 to 19 were 1,196. Embakasi West Sub-County, 26. Embakasi West Sub-County had 29 adolescents, girls aged 10 to 19. All right, just a minute. Wacha nikutumie saa hii. All right, sorry for to someone who was calling me. Yeah, so Embakasi, let me go back to Embakasi Central. Embakasi Central sub-county recorded Embakasi Central sub-county, those ones who are aged 10 to 14 were 176, and 15 to 19, 1,446 respectively. Embakasi East sub-county, 10 to 14 years, 576 young girls were pregnant, while those aged 15 to 19 years were 814. Embakasi North sub-county, 26 young girls were pregnant, aged 10 to 14, while those ones who are 15 to 19, the total number came to 1,476. Embakasi South sub-county, 653 were pregnant, those aged 10 to 14, while those aged 15 to 19 were 1,196. Okay? And then, let me move it down. And then for Kamukunji sub-county, those ones who are aged 10 to 15, those ones who are aged 10 to 14 were 113, while those ones who are aged 15 to 19 who presented themselves with pregnancy at the health centers were 1,712. Kasarani sub-county, 51 young girls aged 10 to 14 were pregnant, and all this data is from the Demographic Health Information System, and it's for Nairobi County for the year 2020. And those ones who are 15 to 19, Kasarani sub-county, who got pregnant were 1,117. Okay. There's someone who was calling me, but someone was calling me. And then for Kibra sub-county, 489 girls aged 489 girls aged 10 to 14 were pregnant. Those ones aged 10 to 14, 489 were pregnant, and those ones aged 15 to 19, the total came to 1,883. Langata sub-county, 30 girls aged 10 to 14 were pregnant, while those ones who aged 15 to 19, 787 were pregnant. Makadara sub-county, 17 young girls aged 10 to 14 presented themselves with pregnancy at the health centers during the first NC visit, and then 1,508 were pregnant for those ones aged 15 to 19. Madare sub-county. So for Madare sub-county, for Madare sub-county, 60 young girls aged 10 to 14 were pregnant, while those aged 15 to 19, 1,374 were pregnant. Roysambu sub-county, 181 young girls aged 10 to 14 were pregnant, while those aged 15 to 19, 653 were pregnant. Ruaraka sub-county, 24 young girls aged 10 to 14 were pregnant, while those ones who while 15 to 19 years, 850 were pregnant. Starehe sub-county recorded 138 girls, 10 to 14 who are pregnant, while 15 to 19, 866 were pregnant. Westland sub-county, 24 had 24 young girls aged 10 to 14 who are pregnant, while those ones who are aged 15 to 19, 958 were pregnant. All right. So today we are here to discuss these rising cases of teenage pregnancy in Nairobi County. And we have on board teenage parents aged 19 years and above who are going to share their experience. So we have a gentleman who's going to share his experience, and we also have a young girl who's 19 years who's going to share her experience. So let me add to the studio. Hi, Judy.
Hi. Can you hear us?
Yes, we can hear you. We can hear you. So let me ask the young mother to share her experience.
Yes, I have
tell her to
here with
introduce herself.
Yes.
And you can also introduce yourself.
Okay, I'm Judy, community health volunteer, and I have with me two adolescent teen mothers who are 19 years, and both of them will share the experiences because they have different experiences. So I'll start with Mama Love.
Rebecca or Mama Love.
So, Mama Love, what really happened to your? What happened? You got pregnant, yes? At which age? And how did you go about it?
I got pregnant. I was nilikuwa form 4 na nilikuwa na 18 years.
Ulikuwa 15 years?
Nilikuwa 18 years.
So vile ulipata mimba ni nini ilifanyika?
Vile nilipata mimba ile yaani kuwa na pressure, mzazi vile alinotice niko na mimba. Sasa hiyo kwanza kugombana unajipia stress. Unakuwa stress na pia nilikuwa na mimba na nilikuwa nakalia mtihani form 4.
What happened?
Nilijikaza tu lakini yaani vile nilikuwa nafanya mtihani ile kujikaza lakini uko na stress, but I thank God nilimaliza mtihani.
Sasa hiyo stress sana sana ilikuwa inatoka kwa majirani, kwa wazazi ama kwa watu wengine wote?
Hiyo stress ilikuwa inatoka kwa both. Majirani wanakuongelea vibaya, unasikia uko form 4 na umepata mimba. Na pia mama yako anakupressure, naongea na sauti, pia majirani bado wanasikia. Sasa hiyo ndio nilikuwa na stress.
Na ukiwa shuleni wenzako walikuwa wanakuona aje?
Yaani ukiwa shule sasa uko na hiyo mimba, yaani una feel yaani uko awkward, uko tu peke yako, kila mtu ako tu kando na wewe, yaani wanakuongelea. Sasa unaweka your mind, sasa niko na mimba na wenzangu sasa wananifanya hivi.
Ili affect mtihani wako ama haiku affect matokeo?
By the hiyo mambo ya stress, yes, nilikuwa na stress. Ili affect, yes. Yaani nilikuwa nataka kupata B+ but nilifail nikapata C+. Sasa Mimi yangu ni nataka kuwa air hostess.
Na walikusumbua uwaonyeshe baba mtoto ama nini, kwa sababu ulikuwa bado unaishi na wazazi wako?
Obvious, lazima walikuwa nataka kuona baba mtoto. Sasa hadi nilikuwa nashangaa na baba mtoto wenyewe hiyo time hakukuanga na job pia yeye. Sasa alikuwa tu anakaa sijui aje. Sasa ile unataka kuonyeshana baba mtoto, yani una imagine sasa ukiona baba mtoto wataniona aje sasa?
Alafu mkafanya nini?
After all, sasa nilimaliza mtihani ndio sasa mamangu akaanza kunipressure uone baba mtoto. Sasa ikabidi nimuonyesha baba mtoto.
Na saa hizi uko wapi? Saa hizi uko wapi? Uko na baba mtoto ama bado uko nyumbani?
Saa hizi sasa ni bado niko nyumbani. Sina baba mtoto, bado ana job.
Violet, you've gotten that?
Yes, I've gotten that. Unaweza huyo mwingine?
Yes, I want to go the other one. So sasa huyu mwingine tutaona yeye Kiswahili ya kuna 2 weeks tu kama amejifungua.
Oh, okay, kuna 2 weeks kama amejifungua.
Kuna 2 weeks kama amejifungua.
Haya, sawa, mwambie aseme story yake basi.
Sawa. Sasa tuambie wewe ni nani, alafu tuambie story yako vile tulienda na.
Mimi ni Mama Jacob. Nilimaliza shule standard 8. Nikafanya kazi ya nyumba. Nikapata mchumba, nikapata sasa nataka kuolewa sasa. Ikabidi niolewe.
Hayuko na umri gani?
Niko na 19 years. Na mimba nilipata nilikuwa na 18 years.
Na sasa nini ilituma utoke shule mapema? Yaani ukimalizia 8 nini ilifanya usiendelee na masomo?
Wazazi wangu hawakuwa na pesa. Alivyokuwa hana pesa, nikaona sasa nifanye kazi za nyumba. Nifanya kazi za nyumba miezi miwili. Kwa 3 ndio nikapata bwana nikaanza niolewe.
Na sasa uko na mpango gani kama wewe mama? Sasa wewe ni mama mdogo. Uko na mpango gani?
Sasa hii lockdown ikiondolewa, mama mkuu alisema hii lockdown ikiondolewa nikirudi nyumbani naenda shule polytechnic kwenye chini.
Na unaweza ambia nini kwa wasichana bado wako nje na watashika mimba?
Waendelee tu kusoma. Wasipate mambo tena ya mabwana.
Kwa nini hutaki wasipate maneno ya mabwana? Asante sana Mama Jacob. Sasa wako naimiza kwamba kwa wale wengine bado wako nje na hawajashika mimba wasitamani hata kupata mimba, kwa sababu kuna challenges mingi sana huku nje. Wanaimiza wadada wengine waendelee na masomo na watie bidii. Back to you, Violet.
Thank you so much. Thank you so much, Judy. Thank you so much, Judy. So now we want to bring a gentleman on board. His name is Mweke. Mweke.
Yeah.
Bana, sama karibu sana kwa studio.
Asante sana.
Hebu tueleze story yako ya kuwa a teenage parents. Yani sasa tuweke aje? Yani ulipata mtoi ukiwa how old? Hebu share jani yako.
Mimi nilipata mtoi nikiwa class tusema niko premo ndio nataka kumaliza, lakini nilisoma nikiwa mtu mzima.
Oh. Kwa hivyo ulipata mtoi ukiwa like 14 years?
Hapana, si 14, nilipata mtoi nikiwa around huko na tusema 19 hapo 18.
Oh, 1918. Aha. So, hebu tueleze challenges gani ulipata kuraise mtoto ukiwa that young?
Challenges nilipata ni wazazi wa msichana wa kuelewi. Sasa most of time wanakupatia responsibility zote, alafu wewe bado ndio ulikuwa unajitegemea, umetoka shule, una wazazi.
Na unanisikia vipoa?
Sasa huo mtoi pressure ilikuwa mingi.
Na dem yako alikuwa how old that time?
Dem yangu alikuwa young sana kunishinda, ndio alikuwa ana form 3.
Kwa hivyo alikuwa ni kama
ndio alikuwa form 3, lakini unajua form 3 alikuwa form 3, I think alikuwa ni kitu 17 years.
Alikuwa 17.
Alikuwa 17. Unajua sasa zingine hizi vitu zingine mnafanyanga kama mu expect vitu kama hizo, cause issue yangu ya kupata mtoi wakati tulikuwa na huo msichana wangu sikujua tutapata mtoto. Sasa after ameenda shule ndio tukuja kukaa, after miezi 9 ndio nikasikia kuna mtoto. Sasa singeweza kumkana, ndio nikakubali mtoto. After hapo ngachukua responsibility zote, ndio nikaamua kufuatilia venye maisha ilikuwa ngumu. Nikatafuta kazi Uarabuni, nikaenda Uarabuni. Huko Uarabuni life bado ikanishinda, ikabidi nirudi.
Alafu maisha iko aje?
Sasa maisha si mbaya, ingalao sasa tunasaidiana. Yeye alimaliza shule, si ile kitu tuliona tufanye. Niliona cause life yetu yote ni muhimu. Mimi ngaamua ni sacrifice wote mamaze shule, na mimi ni sacrifice niweze kusaidia mtoi na njia zingine. Sasa hivi tunaongea, alimaliza form 4 na akafanya kole. Sasa hivi tunaongea na mimi sasa nimeamua, hata mimi nimeamua kurudi shule. Sasa niko nafanya ile ya adult classes, niko nafanya form. Sasa niko nafanya basic ya masomo ya primary, lakini life si mbaya sasa hivi.
Alafu like venye mlikuanga venye wife alipata ball hiyo, venye mkiwa that young hivyo, mlikuwa mnajua kuna kitu inaitwa family planning, kitu kama hiyo? Mlikuwa mnajua kuna kitu kama hiyo ina exist, kutumia condom?
Mimi nilijua kutumia condom hiyo time, cause unajua sisi kwenye nimelelewa kwa prostitution na macho hiyo, hizi tabia nishajua. Sasa ikapen venye huyo demo alikuja kunitembelea, mimi nilitumia protection, na venye nilitumia protection sijui ile happen aje, demo akaniambia unajua saa zingine ina happen uko na protection moja kwa nyumba, ukiwa na moja uko na kamoja tu kamebaki. Sasa kwa kamoja labda mtu anakuambia hajaridhika, akwambia hajaridhika, ndio unapata umefanya vitu zingine kama hizo, ndio after hapo unakuja kusikia uko na mtoi kama hivyo.
Na sasa uko na mawaidha gani unaweza patia? Mawaidha gani unaweza patia maybe adolescents ambao wanajisikia sahi ku have sex? Uko na mawaidha gani? Kama wewe unajua mlipata watoto mkiwa teenagers, so uko na mawaidha gani kwa teenagers wengine? Umenisikia Mweke? Okay. All right. So Beatrice, you've had you've had the 3 cases of the 2 teenage girls. No, 2 teenage. Okay, the young parents who got
sisi tulikimbilia, na sasa ukiangalia unapata life ya mmoja wenu lazima itaenda venye iko imepangwa. Kwa hivyo yangu tu naweza advice, kuna time ya everything. Kwa hivyo si lazima ukimbilie sahi.
Aha. Alafu acha nikuulize, mlikuwa mnaenda hiyo time mlikuwa mnaenda maybe hospitali kupata information? Ame disappear. Anyway. Okay, unanisikia?
Nakusikia.
Nilikuwa nakuuliza, mulikuwa mnajua like kuna kitu inaitwa youth friendly centers? Ulikuwa unajua kama kuna facilities zinaitwa youth friendly centers za gava ambayo mnaweza enda mpate information, mfanye vitu? Enzi yenu ilikuwa?
Hiyo yetu ikukuwa. Unajua mimi ile slum nimetoka slum ile Kinyago. Hiyo slum I think hatuko na hiyo awareness because most of time sisi watoto wadogo tulikuwa tunachukuliwa wadogo because nimesoma primary niko mdogo. Sasa some information hampatiwi. Some information zinapata watoto wa secondary. Lakini sisi watu wa primary hatupatiwi information, lakini kuna vitu tushajua tukiwa wadogo, lakini sasa zile information inapeanwa si hatupewi.
So uko na message gani kwa gava? Unanisikia Mweke?
This generation imechange. Unajua every day generations zina change. Na ukiangalia hii generation yenye iko ukiangalia kama ni mambo ya music, ni they talking about, wanaongelea tu mambo hii uchafu tu. Kwa hivyo ile advice ningewapea ama youth wanaweza ongeleshwa. The main thing ndio ile advice naweza kupatia gava. Huku kwa slum ile life yenye sisi tunaishi tusipopata. So you've
this network ati hiyo life mnaishi
ile life yenye tunaishi, tunakuwa watu wazima tukiwa watoto. Tukiwa watoto bado si ni watu wazima. Kuna vitu zingine tunajua very stage yale. Sasa kwa hivyo mimi ningependa gava ikuje kwa hizi slums iwaongeleshe. The main thing ni sisi tuongeleshwe, tujue what is right na what is wrong.
Na Judy Mama Jacob na Susan wote hao wametoka slum gani? Okay, huyu atusikii vipoa. So asante Mweke for sharing your story. Pia hapa tuko na mkubwa wa gava hapa, so kama utakuwa na maswali unataka kumuuliza utamuuliza baadaye. So wacha sasa Beatrice apeane pia mawaidha. So Beatrice,
yes.
You've heard from the young parents. What's your take on what they have shared?
First of all, I want to appreciate the opportunity to participate in this show. It's good I introduce myself. I'm Dr. Beatrice Nzo. I'm a counseling psychologist, a member of Counselors and Psychologists Society of Kenya. Listening to what Mama Love, Mama Jacob, and Mr. Mweke have shared, the first thing that I want to do is to congratulate all of them because they all took up responsibility of what happened to them. Many would have had an abortion and forget about it, but the fact that they decided to move on, carry the pregnancy to full term, and bring up the children, I think they need to be congratulated. And listening to what they have to say, one does realize that we have a missing link. And Mweke has really raised that one up. He has said that living in the slums, and this is not only in the slums, I think it is in the all situations, that most of the times there is no program for the young people to be told what is right and what is wrong. And kind of they are left on their own to vent for their own way. They learn from their peers, and this will always lead to people learning the wrong things. So as parents, wherever we are, whether we are in the slums or in the posh areas, we need to create time to be able to tell our children when they are young the truth about life. What can they get involved in and what can they get involved in? It's good to know. And this has also been shared by the three people who have shared, by Mama Jacob, and Mama Love, and Mweke has also shared it, that when these young people become parents, the responsibilities are so huge for them. You realize, like Mweke's case, he was left to vent and provide for the child and the mother. And this, he had no job and he had to drop out of school. So when the young teenagers become parents, then there are those challenges that, like the cost of raising the child is not easy. And they have also their social status will change because they are now not mature parents, neither are they young people. Neither are they children. They get and attain responsibility when they have no means of providing for those responsibilities. The other thing is that this came out very well with Mama Jacob, that no, it came out very well with Mama Love, that there is likelihood of family conflicts. The parents will put pressure because remember, the parents have always wanted you to be a good girl, a good boy. So the moment you become pregnant, kind of they feel you have let them down. The church will look at you as a sinner. The society will look at you as a failure. And as Mama Love said, the school, the peers will just even want to ignore you, have nothing to do with you. And this can be very traumatizing psychologically. And that's why the society needs to be educated to learn that the moment this has happened, the pregnancy is there. It's like water has been poured down. You cannot collect that water and use it again. So the best thing that the society needs to know, and even the teenager themselves, is that it has happened. What is the way forward? I like the way Mweke organized himself, took up a job, went even to Arabuni, came back, and ensured that the mother of the child finished school, went to college, and right now he has joined the adult education himself. I think this is really a person that needs to be supported. So as parents, as the government, as the society, as the church, we all have a part to partake when it comes to teenage pregnancy. And nobody can say they are off the hook because it is a problem that is with us. It is an issue that is there. Looking at the statistics that we were given, that 10 to 14 years, 2,603 were pregnant in Nairobi alone, and 19,560 age range of 15 to 19 years. These are really alarming figures, and all the reason why the government needs to come up with counseling services so that these young people can be counseled, can be taught life skills in order to live and grow up to the maturity that is required by law. Thank you, Violet.
All right. Thank you, Dr. Beatrice, for the advice. So I'd like to bring on board Mercy. Mercy, kindly introduce yourself so that the viewers may get to learn more about you.
I'm Mercy Ndambi, here on behalf of Violet Mbiti Foundation as the project assistant. Yes.
All right. So I'd like to also bring on board Madam Faith Kirudi. So Madam Faith, kindly introduce yourself to the viewers.
Unmute, yeah.
Oh, hi everybody. My name is Faith. I work for NMS as the Adolescent Health Coordinator.
All right, all right. So, Mercy, maybe you may start with the first question to Madam Faith.
Okay, I got the first question that I will ask. Given the urgency in responding to COVID-19 and with decreasing support from donors, how can Nairobi Metropolitan Services best finance initiatives to reduce teenage pregnancy and improve health indicators over the long term, particularly for the vulnerable teens?
Okay, you see, despite the COVID response, we still need to continue with services for the other services for the general population, the adolescents themselves, because even when in the midst of COVID, when COVID came in, we also needed to see how we would continue with service provision, and we just had to be innovative. So we would do community distribution of commodities like contraceptives, condoms, and also we'll do online support groups, because you see support groups are not going on in the facilities. And then in the process would combine COVID messaging webinars with other SRH messages for the young people, and we would invite young people to attend online. We partnered with different partners to implement that. But despite COVID services, we still had to prioritize other services for the community, including AYSRH services, and actually they continued. And also, we were trying to see, right now we are also working towards community dialogue days with parents. Everybody can agree with me that parenting is a challenge and we need to work as a team. This issue of teenage pregnancy is more than just service delivery. It requires a multi-sectoral collaboration, because the health workers are just offering the healthcare service, but there is more that is contributing to teenage pregnancies than just even the issue of contraceptives and all that. There's the issue of poverty, there's the issue of lack of jobs, there's the issue of peer pressure, there's issue of even lack of parenting itself. So it's something that people need to work together as a team, and also to tackle teenage pregnancy. Otherwise, we cannot look at with one dimension of health only and counseling only, but we need to ensure we bring everybody on board and really discuss, because it's more than just getting pregnant for a young person. Because if you speak to some of the young people, they are actually doing not having they are having sex to benefit or get something as simple as sanitary pads, because they cannot afford a sanitary pads, and in the process now they get pregnant. So now what happens is, so we need to think of how to empower. I like the way Mweke talked about, despite that everything happened, he went to school because he wanted to empower himself and become someone in the society. So we also need to also think about empowering the young people. You can get pregnant, doesn't mean that that's the end of life. We need to think of how to even uh, work around the skills of young people, that because some young people have talents that they can bring food on the table, and once they do that, they can use that talent to earn a living, and then you'll find some of the challenges they are facing, they can be able to tackle them.
All right. So I have a question for you. Like, how many youth-friendly centers are functional? Or like, how many are functional and how many are in the pipeline in Nairobi County?
When you talk about comprehensive youth-friendly services, definitely it has its own challenges, because there are so many factors that you need to look at when you're looking at a youth-friendly service. There's the issue of infrastructure, there's the issue of human resource, there's the issue of commodity. For us, what we are looking at right now, and it's what I keep on telling people, we need to start thinking of youth responsive services. Youth responsive services is where services are integrated, such that a young person like Faith comes in and wants to be cancelled on a method or wants to do a HIV test. They are done in a facility and they get the service and they go home happy. So right now we are having youth friendly centers that are around 22. We cannot say they are comprehensive because they do not have all that it takes like a youth friendly service. So, and the other thing is we need to encourage the young people to own their own health. They need to take responsibility of their own health, because you cannot tell me that we need to have a Wi-Fi, a pool table, and all that so that the youth can come to the facility. What we need to do is empower the young people to know their own health, own their own health. They will always come to the facility and they will not look at, say, at nurse A is an old person. I want a nurse who is young, and maybe that facility does not have a young nurse, and the older nurse can give a service. And also we are working towards attitude change, because I know there's an issue between the young people and the older healthcare workers. They feel they cannot serve them well. So we are trying to work through that the health workers also look at the young people not as you're looking at your child, but look at it like someone who is coming to ask for a service and you offer the service. So attitude change is a two-way traffic. So we are working towards improving the attitude of the young people and also the attitude of the service providers, so that they can come together at a common understanding and also for the benefit of the young person.
All right. So thank you for your for the answer. So I just wanted to ask, is there a technical working group on adolescent health in Nairobi County?
Yes, we have a technical working group for Nairobi County and also Nairobi NMS, Nairobi Metropolitan Services, and also Nairobi Metropolitan Services also participate in the Nairobi County at the Teenage Pregnancy Technical Working Group that is coordinated at the County Commissioner's Office. So we are part of the team that participates in that technical working group. And also the young people participate in our youth technical working group.
So in short, you are saying that there are even CSOs who are represented in those working groups?
Yes, they are. You are one of them.
Awesome. Awesome. So Mercy, do you have a question for
yes, I have a question. Does the Nairobi Metropolitan Service have any work plan that will include the adolescents in this about CRH?
Yes, we have our annual work plan, and also even Violet knows we have the Youth Advisory Council members who actually have their work plan, and some of the activities that are in their work plan are actually supported and implemented through Nairobi Metropolitan Services. So we have activities that are actually touching the young people, like focus group discussions. We even have the young people who sit in the sub-counties, not only even at the county. They sit in the sub-county meetings, and they plan with the sub-county in terms of activities that they are doing. So when you are developing our work plan, we also ask, like the Youth Advisory Council, they always advise us on some of the activities that they would like to see in the annual work plan for adolescent health unit, which is now compiled in the whole work plan for NMS health sector.
And what are some of the priority activities that you plan for them?
We plan as per need, because like now, if teenage pregnancy is something that is alarming, we need to think around on how we support. And also, like now, we are trying to come up with support groups for teenage mothers, where teenage mothers sit and share their experiences and stories, and then we see how we can work together. And also we are trying to work around with to discover adolescents with talent. Like yesterday, I was in a focus group discussion with some young girls. Some were saying, "For me, I know if I got support, I would make soap." And the others were saying, "We'll plant some vegetables for sale." So you see, with all those ideas, they have the ideas, but they have not gotten someone who can really push them to execute those ideas to bring money on the table. So for them, because they are pregnant, they are most of them actually had children. So doesn't mean that they sit back and watch. So we were trying to encourage them how they can use that talent, come and having even coming together as a team and see how much do we have, how much soap. We calculated with 500 they'll make like 20 liters of soap. If you sell that 20 liters of soap, it will come to around 1,000 shillings. So when you try showing them that, that's when they discover, yes, I don't have to sit down and wait. I have something I can do. So it's on need basis that we plan, but we also plan as per the needs of the county, or rather NMS. Our needs is where we prioritize first, because for us we don't look on or to only teenage pregnancy. We even have HIV. If you look at our data, and our data is the one that informs us how to actually plan.
Awesome,
Okay.
awesome.
Last question on that. And when you identify the activities, do you allocate resources to support such activities, or there are some that you support, others? How do you go about it?
Our work plan is a resource mobilization tool. So when we have a work plan, we actually budget it. It's a budgeted work plan. So we can either resource from the government or even our partners. We share with our partners some of the activities that then we have that needs their support. So we resource mobilize for the activities that are in the work plan. And so actually they are executed. Either they can be funded directly by the government or even our partners can support us.
Awesome, awesome.
Okay.
All right. So thank you, Mercy, for the questions. Mweke, Judy, you've heard from Madam Faith. Do you have any questions for her? Even Dr. Beatrice, do you have any questions for Madam Faith? So this is opportune time for you to ask if you have any questions for her, and then now we'll conclude the show.
I might not have a question per se, but I want to congratulate her with her team for the good work that they are doing. I like the idea of support group for the teenage mothers, but don't forget about a support group for the teenage fathers. You heard what Mweke said, and the boy child. Right now, the boy child needs to be looked into, because we have put so much effort, so much emphasis, so much focus on the girl child that our young men are getting so as you budget for the support group for the teenage mothers, think about the teenage fathers. Have them have something to do. You heard what Mweke shared. It is very difficult, but they need to be supported. Otherwise, congratulations, you are doing a good job.
Awesome.
Thank you, Beatrice. Thank you so much for that. And actually, it's true. Because we need to have the boy child involved. Because if you look at it literally, these girls are not getting pregnant on their own. They are getting pregnant with these boys. And right now, actually, most of the teenage pregnancies are with their peers. So we need to really have support from the boys so that we can. We have tried to work with AHF. We have a support group for young men, though it's not well. We are still trying, but I think it's something that we have been thinking about, because, as I said, it's a collaborative effort. It cannot be left alone for one party to handle issues of teenage pregnancy, because we'll keep on talking about them forever and the numbers will never go down. So we need really, I appreciate that, and it's something positive to think about. Thank you.
And lastly, even as you manage the teenage girls and boys, there is also need to have something to support the parents. Remember what Mama Love said? She went through a lot of stress, that the mother put a lot of stress on her. So there is need for a program that can educate and empower the parents so that they can learn to support the teenage parents. Because once it has happened, it has happened. And if they are pushed to the corner, sometimes that's why they think of suicide. So it's good to prevent rather than to start saying we wish we knew. But you are doing a good job. I agree. But those are some of the things that you need to look at. Thank you.
Actually, yes, thank you so much for that. We have tried focus group discussions with parents. I work with a group of young people, the Youth Advisory Council. It's a group of young people representing the 10 sub-counties. In health, we work in the 10 sub-counties. And on the ground, we actually have focus group discussions with parents. And then we bring the parents and the adolescents together and have a discussion and see what happened. Because if you talk to the young people, most of them blame the parents that they are pushing them, they don't understand them. As I said, parenting has become a challenge, and I agree with you. We need to start now rethinking again. We need to do things different because others will keep on talking about issue of teenage pregnancy forever. We need to look at all aspects and all angles that can help us tackle the issue of teenage pregnancy. And parents, sometimes they need to take responsibility. We've left so much for the health workers, for the counselors, for the teachers to do their work. So we also need to empower the parents to actually, talking about sexuality with your children. Sometimes it's a taboo, it's not accepted in some cultures. But I think we need to empower our parents so that they can actually start talking about these issues as early as possible. Because if you don't talk to a child at 8 at 10, when you are 17, what is your parent telling you? So you find that's why you find most of the young people are rebellious to their parents because their parents never started these conversations early enough. So I think it's something we can easily work around, and you can always consult and see how you can also support us in terms of coming up with support for parents. You are
Wow, wow,
welcome.
wow. It has been an awesome session. We are so delighted that Madam Faith, you graced you graced the set. We also want to appreciate Mweke together with the Mama Jacob and Susan and Judy for sharing their stories. And we just hope that like now this conversation, at least now, even you as a member of the public or even a resident residing in Nairobi, most of the time they are saying, oh, the county government is not doing this, is not doing that. But today we brought Madam Faith, the adolescent health coordinator, on board so that you can see the tremendous, awesome work that they are doing. And they also do need your support. So if you would like to partner with the county, with county government, even with NMS, you're welcome to do so. So, Madam Faith, do you welcome partners to partner with you at NMS, or you already have enough
Very
partners?
much. No, actually, I'm asking if there are those who want to partner, they just come through the director's office and we are good to go because there's so much to do for young people and different ideas. You see, it's even you can come and share ideas like the way Dr. Beatrice has actually talked about issues of parents. So it's if we went and talked to her and we looked at how we can structure something for parents, that's partnership, which we can actually come up with something to support the parents. Our offices are welcome for anybody who wants to partner with NMS. And also, we always tell people that we also have a work plan and we actually synchronize what the partner has and what we have in our work plans. And then all of us, because we have one objective to serve the common mwananchi in Nairobi County.
Awesome, awesome. So, Mercy, do you have any question for her, or you are good?
I'm good. I'm good.
Okay. Dr. Beatrice, you are no question?
I'm okay. I've given my contact and my email address. Our offices are in Kenyatta KICC, Counselors and Psychologists Society of Kenya. You can always get in touch with us and we see what we can do with you as partners.
Awesome. Awesome.
Thank you so much, Daktari. I'm taking your contact.
Okay. So, viewer, thank you for joining today's discussion. It was insightful, and we hope that even the teenagers who even listened into this broadcast have got the necessary information from the young parents who shared their story on how they became pregnant at a young age and the lessons learned. So see you next time, even as we engage further on this talk on teenage pregnancy in other counties as well. So asante sana, tunashukuru. Asante.